Luis, ¿tienes noticias de Víctor?
Ya debería estar listo, ahorita lo confirmo. Una pregunta acerca del link de YouTube. Yo creo que Víctor ya está tratando de entrar.
Bueno, si le puedes dar acceso tú.
Y también a Serida le voy a dar acceso.
Nos avisas cuando estén y empezamos.
Bushra Admula, que es la directora de Abu Dhabi, también está. Le doy acceso, ¿no?
Sí, perfecto. Quien necesitaríamos en un minuto es Víctor y la Special Envoy. Federico, ¿me dices?
Le voy a llamar a la Special Envoy.
Sí.
Welcome, Ms. Almula. We are waiting to allow participants to get in 1 minute, and we will start the meeting.
Hello, Pablo. Thank you.
Hello, welcome. I'm letting in the Special Envoy of the United Nations, and we are ready to start only if Victor is here. Enviada especial, bienvenida. Si me dan el ok, Víctor y Luis, empezamos. Federico y Luis, perdón.
Creo que sí estamos bien.
Porque además empezamos con la ID y con Emilia, que eso nos dará tiempo, ¿no? Solo confirmar que sí, Víctor efectivamente se une. Okay, colleagues, welcome everybody. We're going to start letting participants in. We have our Secretary General ready and the UN Habitat EV ready and the Special Envoy ready as well. So I'm going to share my screen. Be patient. In about 3 minutes, we will start formally the meeting. Ready, colleagues. Dear colleagues, on behalf of the World Organization of United Cities and Local Governments, UN Habitat, together with Metropolis, and on this occasion with our colleagues from World Enabled and Cities for All, we welcome you back to our live learning experience beyond the outbreak. Colleagues, allow me to share with you some technical notes before yielding the floor to the Secretary General of UCLG. As always, we will have interpretation in English, Spanish, and French. We ask you to mute yourself when not speaking, and when speaking, to turn on your video, speak clearly and towards the microphone, and select only to see the active speaker. We suggest this to be able to see the slides. We will have, as in every of our sessions, an online consultations. So go to your mobile phone to menti.com and use the code 357918. In this occasion, colleagues, we have closed caption. Go to the end of the screen and select the closed caption icon if you want to use this option. It will be available in English. Having said this, welcome back. I now yield the floor to our Secretary General, Emilia Saiz. Emilia, the floor is yours.
Hello, everybody. Welcome back once more to these exciting exchange experiences. And this one on equity and access in times of pandemic is very dear to my heart, not only because we have wonderful partners in the organization of World Enabled and in President Victor Pineda, but also because it is a very critical topic. And you are going to be hearing many notions this afternoon, but I just wanted to leave with you a thought that is what drove United Cities and local governments into this partnership with World Enabled, and what inspired us to go into a town hall process where communities and those with the experience inspired our policy recommendations on this field. Let us be honest, friends. Our cities are not designed for everybody. They are not accessible. And this has always been an issue, but now, in times of this unprecedented pandemic, is becoming very painful, more critical than ever, but also something that we all care about, because the security and the well-being and the livelihood of everybody is becoming an issue of security for everybody else. So we can no longer conceive a society, I think, in the aftermath of the pandemic, where some of these invisible groups of populations, which are usually the most vulnerable, are left alone and no longer considered. Our political systems are not ready, our accessibility and policies are not ready, our public spaces are not ready, and we, local and regional governments and their associations, need to pick up this responsibility, need to walk the talk, and need to foster true changes. That's what we're doing here today. It's not an abstract narrative that we are trying to promote. It's actually taking responsibility, despite of all the good things that you are going to be hearing, many of the cities that are with us today, all the innovative policies, all the groundbreaking innovations that they are trying to implement. The reality is the urban era is not an accessible era for everybody. So let us put our heads together. I think there is an unprecedented opportunity in this pandemic. Many things that we are doing now were considered impossible only 2 months ago. It can be a true opportunity. It's not a naive statement, as I always say. We need to take the responsibility and change things. And local and regional governments have a lot of the competencies to be able to change the lives of many citizens around the world. That's what the session is about today. I'm really excited to have so many good partners and so many interesting cities that have been actually doing things to share their experiences with us. So I'll leave it there. And as always, it is a great pleasure to introduce to you Maimouna Modis Sharif, Undersecretary General of the United Nations and Executive Director of UN Habitat, an organization that has always put this topic very high on the political agenda. I think we made great progress as we were negotiating the Habitat 3 new urban agenda. Many of the things that are in there are critical for true real access for all. Maimuna, the floor is yours. Thank you for being with us once again.
Thank you very much, Emilia. Thank you. Good morning, good afternoon, good evening from Kuala Lumpur. I'm back to Kuala Lumpur to be with my family for the Eid celebration. So I'm still working from home. It's not on holiday yet. That's why I'm now it's around 10:15 at night in Kuala Lumpur. Yes, as you said, Emilia, 4 months ago, the city of Wuhan was about to declare a health emergency. And since then, the world has changed. The pandemic has affected everybody, but unequally. Many are even more marginalized now, with the World Bank estimating that 60 million people will fall into extreme poverty. The response measures create physical, attitudinal, environmental, and institutional barriers. Marginalized communities suffer. Persons with disabilities and older persons face obstacles and discrimination in accessing healthcare and other essential services. They face social protection challenges and income insecurity and miss out mental health services. So digital communication while staying at home is difficult for those with poor hearing or sight or other challenges. UN Habitat, as you said, voice and action for inclusion and against inequality are, of course, at the heart of our mission and also in the midst of this pandemic. So in the successive learning session that we had since 25th March, Emilia, together with UCLG and Metropolis, and so many close partners, inclusion has been a key benchmark to measure successful action of cities and local governments facing the impact of health crisis and the lockdown responses. For instance, I recall our first session on adequate housing and its strong message on homelessness. Countless homeless people are extremely vulnerable people with underlying health problems and problem of social exclusion. Those who have with us in the learning session weeks after week have heard the testimony of cities responding to issues of inclusion and injustice in the context of migration, local economics development, informality, to recall a few of many challenges. Cities are at the front line of this crisis, and they would continue to be in the future when medium and long-term responses will be implemented. The loss of employment will tend to generate greater social polarization. The impacts will be larger but uneven in cities and regions, particularly in those where inequality patterns already existed. UN Habitat documented in the World Cities Report in 2015 that 70% of the cities in the world were growing more unequal, even now more, even in societies that were considered more egalitarian. So in 2015, the World Economic Forum considered that inequality was universal concern and one of the major threats to world stability. This pandemic will further exacerbate the urban divide. The intersection of poverty and equality will become more visible in cities, and disadvantages will concentrate in specific areas and neighborhoods. Policies and action are needed to avoid and reduce such impact, especially for the most vulnerable. UN Habitat therefore started preparing a special edition of the State of the World Cities Report, focused on the impact and solution beyond the COVID-19 outbreak. Dear friends, we will celebrate the Global Accessibility Day tomorrow, 21st May. We are putting the issue of accessibility front and center. I am grateful for the intense collaboration with UCLG, World Enable, International Development Banks, and member states, including our friends from Germany. Today's focus on inclusion accessibility should make our mission for inclusion more tangible. Older person and person with disabilities constitute a significant and increasing segment of urban population anywhere in the world. I call on all cities to participate in the Cities for All COVID-19 Inclusive and Accessible Cities Pilot Survey we are initiating together. Lack of disability and older person disaggregated data makes it difficult to carry out evidence-based analysis of the socioeconomic impacts of the COVID-19 crisis. Disability and older person disaggregated data in recovery and COVID-19 response must include data on barriers and improve accessibility. I also urge city managers to work closely with available disabled peoples and older person organization by giving them a seat at the table. This group will ensure that their perspective in the pandemic response are considered and provide ideas for more inclusion using their own expertise and experience. I call on city and regional leaders to ensure legislation and policies establish the necessary enabling environment to disability and older person inclusive pandemic response. In many countries, we need to be extra mindful about needs of the older women and girls with disabilities. Response programs and service needs to be accessible to and usable by person with disabilities and older person where they ensure universal design principles are followed. In conclusion, it is important for states, regional and local government to ensure more inclusive, accessible, agile system capable of responding pandemic and future disasters by reaching out to those furthest left behind. This will pave the way for inclusive cities and a better future for all. UN Habitat will always be with all of you. Thank you very much. Emilia, over to you.
Thank you very much, Executive Director. And we do fully understand if you need to leave us, because even though you are not on holidays, it is very late there over in Kuala Lumpur. So thank you for those additional efforts that we know you always make. And indeed, there is no better life for all without accessibility.
I will join you. I will join you. No problem. It's okay.
Thank you so much. Thank you so much.
Okay.
A diehard, Maimuna. Thank you very much. So
okay.
I would like to invite now Maria Soledad Cisterna Reyes, UN Special Envoy on Accessibility, a friend and a trusted leader for us all on this topic, and someone that did lead also the process of the town hall and was with us in the UCLG Congress in Durban. It seems like ages ago, but it's not that far away. And we have very good memories of those inputs. So Maria Soledad, the floor is yours. Welcome and thank you for joining us. Are you ready?
Yes, I am ready. Yeah, okay, thank you very much. Hello to the colleagues and at the same time to the audience that is with us now. The good news is the joint statement about persons with disabilities and local governments and pandemic that prepared with the World Enable and myself as a special envoy of the United Nations Secretary General about disability and accessibility. And this statement, it is very important to us recognize the accessibility as a principle of a CRPD, an obligation for the states parties in relation to physical space, transportation, information, communication, technology, to give the opportunity to persons with disability to live independently, including in the community in equal condition among others. The second idea is to recognize that accessibility is the most mainstreamed legal structure in the human rights field in 21st century, based in universal design. The third importance is the contemplate of accessibility in the 2030 agenda, especially when it refers to green areas and physical space and transportation. But now with the pandemic, we face a huge negative impact in relation to persons with disabilities. And you can see that many persons with disabilities and older persons live in poverty and imaginality, aggravated with the lack of accessibility. And now with the pandemic, the situation is bad because the lack of accessibility increasing the multidimensional poverty. For this reason, we recognize the leadership of the local government because they are in direct connection with the population in their respective jurisdiction, and they are in direct connection with the needs of this population and the addressing with the central government to care the well-being, the welfare of persons with disabilities and older persons, the neighbors, finally. And taking into account this situation, we call to the leadership of local government to take the full participation of the citizens to create the full inclusion for the preparation, elaboration of public policies, legislation, plans, programs, etc., to face the pandemic, but to take advantage of this experience and to put in the new plans and programs in the future. Accessibility is now, but forever in the cities or other places in the future. And obviously, without discrimination, stereotypes, prejudice, and harmful practices. Our second call is in relation to the unit, cities, and local government organization that is the voice of local government to put in a center of their action plan with the topic of accessibility, universal accessibility for all persons. And we would like to work together with this organization and the local government to work with the citizens, providing the needs in terms of accessibility, because more accessibility is more development, taking into account CRPD, 2030 agenda, urban agenda, the framework of Sendai in the case of disasters, among other documents, such as the network of a friendly citizen for older persons. And finally, I would like to emphasize the great initiative of Global Compact, because Global Compact is really the space for the dialogue among different local government and different stakeholders, the space to exchange experience, the interaction, to get partnership, to make a reality of the accessibility for the fulfillment of human rights and sustainable development. And I would like to invite to different cities to come here to the Global Compact and to be a member of the great and universal consensus. Thank you very much.
Thank you very much, Special Envoy. Thank you, Maria Soledad. Very important points and full commitment from our side to bring this to the political agenda where it needs to be. I mean, you will all agree with me, right, colleagues? I am jumping the script here, but I mean, for me, it is unthinkable that we would not invite Victor Pineda to say hello, because this is his home, he's doing, and he needs to greet us all before we carry on with the debates. Victor, the floor is yours. Promise you will be brief because you will be speaking later.
Of course, I just wanted to commend the UN Special Envoy, our dear friend Mahmoud Sharif, for their steadfast leadership. Like you know, Amelia, when we launched the Global Compact with GIZ and partners around the world a year and a half ago, we didn't realize that it would completely impact people's lives as it has today. The COVID experience and today's webinar is an example of how cities around the world get leadership by the UN, and directly the city network of UCLG is making an impact. And we're delighted to partner with you on the Global Compact, inclusive and accessible cities, in this theme of inclusive pandemic response. Thank you so much.
Thank you so much, Victor. So let us now move to the next segment of these live learning experiences. And this is usually a small survey. We want to take the pulse of the room. We are 200 people here in this room, but we are also broadcasting on YouTube and LinkedIn, I've been told by our team. I would like to give the floor to Federico Batista Poitier, whom you all know as a collaborator of World Enable, and now also in our offices of United Cities and local government, a shared asset, I would say. Federico, the floor is yours to lead us through the Mentimeter survey.
All right, everyone. I'm glad to see so many participants here. So as we're going in, please go to menti.com and use the code 357918. And so while people are getting in, there's some words coming up on the screen to the question that what is one word that comes to mind when thinking of the term accessible? Once you get into the Menti, please put in the words that come to mind. We have barriers, universal, inclusion, rights, entitled, freedom. Freedom is big. The larger the word is, the more people put in there. So I like this idea of freedom. We'll just give like another minute or so. But yeah, I think that, yeah, inclusion, equality, freedom is big. So I think one big thing that we know is the more accessible the world is, the more free we are. Inclusion is another. Justice is coming up as well. Innovation I like, because I always say accessibility is innovation. So I guess, yeah, we'll go to the next slide. We also share a briefing after, so you'll see some of these words following in the briefing. All right, so the next is, how effectively do you think accessibility policies have been implemented in your local and regional government? So we have from a scale from 1 to 5, 5 being extremely well implemented and 0 being not implemented at all. All right, so we're in the middle on the lower 2s. Well, maybe not the middle yet, but lower 2s, but maybe getting into the into the center. 2.8. So
this also shows the balance of the type of participants that we have. We have local governments which are really convinced and trying to do their best, but we also have a lot of people that are experiencing and looking at this topic very critically. I think it's quite a fair reflection of how our world looks like in general, right, Federico?
Yeah, exactly. And I like to think of it as the glass half full. You know, we're getting towards that strong implementation. So, so let me go to the next one. So The next one is asking you to choose between 3 of the options that you'll see on your screen. So what are the main challenges to implementing urban accessibility policies and standards? Is it budget constraints, interagency coordination, local government leadership, lack of training and tools to implement accessibility policies, the lack of local data to identify accessibility barriers for marginalized groups, or limited awareness and understanding of accessibility? So we're seeing the bars coming up. The big thing is interesting, you know, I'm always thinking that it's budget, but it looks like it's limited awareness and understanding. So
I also chose limited awareness, if I need to be frank with you, Federico, because this is what I'm finding with our membership. A lot of them would have the political will to do this, and they would try and find the means to do it, but very often they don't know how to approach this. And I even can say that for United Cities and local governments, and that is one of the reasons, not the only reason, why you are with us and we are partnering with World Enabled, because I think it has been on our agenda, but there are many things that we just don't understand. So having a greater understanding is very important. I mean, the other columns are important too, I would say, but I am happy this is one of the highest one. It gives me hope.
Yeah, me as well. I hope for the others too. It's really strong that the more understanding and capacity building we have, the more inclusive and accessible our cities can be. And so the last one is more directed at COVID. So in your opinion, and what you've seen in your cities, what are the COVID-19 emergency response priorities to guarantee equity and autonomy of persons with disabilities and older persons? So we have 4 options: information in accessible formats, digital inclusion, mobility, and social and mental health services. So these are 4 options that we've seen kind of trending a lot in terms of media and responses that some cities are taking. Looks like social and mental health care services are coming up, of course, information in accessible formats. And I think the aspect of social and mental health care services speaks to a lot of the confinement measures happening, and also limited access to public services to follow these confinement and stay-at-home orders. And of course, the information gap, you know, making sure that we have timely access to information that's important on what's happening, like in Barcelona, on the phases of reopening or confinement.
Thanks, Federico. Is this the last question that you had for us?
Yeah, this is the last question, and thank you all for participating.
Thank you very much. We will make sure that we put this information to good use. I have to confess, I was a little bit surprised about not a higher percentage of those last answers to go to digital inclusion, which I think is a very critical aspect. So, but this is why we hold these tiny surveys, because sometimes those answers can surprise us and can guide us to promote a different type of policy and fostering new debates. Let us go to the next section now. Thank you, Federico, and thank you, team, for putting this together. We have a very impressive panel, too impressive maybe, with too many very good cases and very little time, so we don't know how we're going to manage that. Let us start right away to hear about the perspectives from the local governments, those that are doing day in and day out this job. And I am very pleased to have with us from far away as well, where I am sitting from Indonesia, the mayor of Banjarmasin, Ibnu Sina. We are very grateful to have you with us and to share your perspectives and experiences there. Are you ready?
Okay. Thank you, Emilia. Thank you very much for this event. I'm Ibnu Sina Banjarmasin from Indonesia. In Banjarmasin city is a capital city of South Borneo, in Borneo Island. In Banjarmasin, we have 700 population, and in Banjarmasin, how is the COVID-19 emergency affecting inclusion in Banjarmasin? You can look at the map, red zone. This is a river and local government. The city of Banjarmasin conduct large-scale social restrict or PSBB to prevent massive outbreak of COVID-19. And ini bisa nggak? Sorry. Bisa baca saya ini. Sorry. Oh yes. Okay. I can continue. It limits access to all public facilities, including public transportation, school and workplace. It also restricts congregation for religious purpose, sport applying protocol for limitation of services like restaurant, mall, also activities like construction. Now the city has reduced the number of public activities significantly. The situation also was threat to livelihood and economic condition of the most vulnerable group in the city. Daily worker, many of them are informal, have low source of income in the public health sector. Banjarmasin long-term commitment toward group like people with disabilities, elderly, have prepared the city to act on the target action. Next slide. The city government of Banjarmasin formed special task force. We have special task force of COVID-19 response that integrated multi-stakeholder, like the local agency for disaster countermeasure, the health office, and the police and municipal police and order. We are implementing the strict health protocol and make sure people are staying at home. In response to this health protocol, the city of Banjarmasin collaborate with state-owned companies, school and universities, micro, small, and medium-sized enterprise, and community-based organization to produce our own hand sanitizer and face masks, special face mask, including see-through face mask for person with hearing impairment, and distribute it to citizens of Banjarmasin. And last point, the vulnerable group, including person with disability, elderly, and urban poor, affected by the outbreak, face financial issue. Therefore, the city of Banjarmasin, with support from multi-stakeholder, prepare social safety net, stroke distribution of assistance, direct cash and assistance, and basic food. To ensure food supply, particularly during Ramadan, the city of Banjarmasin, together with this community, provide public kitchen for residents in need. And during the pandemic, the Banjarmasin city government guarantee basic rights such as basic necessities, the right of information, the right to health services, and the right of minority, marginal group, and vulnerable group. Media information is use science language. Social and economic impact are overcome with social safety net program to get basic access right and transparent mass distribution. I think that's Banjarmasin action, for collaboration, and we hope this pandemic will drop. Yeah. Thank you very much.
Thank you, Mayor. We too, we all hope that we will be able to bend the curve, that we will be able to overcome this great suffering for millions of people in the planet. But it is good to see how important things are on your agenda. And I am particularly pleased to hear about the social safety net, because in a moment where everybody's talking about social distancing, we keep saying local and regional governments want physical distancing to be safe, but social closeness and social safety net. Thank you very much, Mayor, for
thank you very much
for your inputs. Allow me now to go to the next speaker that I have in my list. Cid Torquato, Commissioner of the Mayor's Office for People with Disabilities from São Paulo. And I have seen you. Oh, yes, I see you there, sir. The floor is yours. Welcome.
Well, thank you very much. I'd like to, it's a great honor for us of the city of São Paulo to participate in this, so important event. To begin with, I bring a warm embrace from our mayor, Bruno Covas, who's a strong supporter of all our actions in terms of our secretariat. So I would like to thank him for for letting us do everything that we've been doing. Well, I was invited to talk about what we're doing in São Paulo in order to mitigate the impact of the virus in our population with disabilities, in our persons with disabilities. And what I have to do is that, I mean, we're working in very many different fields in order to provide assistance to the persons with disabilities that most needed. So we are monitoring all the associations and organizations that work directly with persons with disabilities, as well as we built a center only for persons with disabilities that live in the streets, homeless persons with disabilities, where we provide, besides all the normal services that you have in such centers, we have specific services directed to our public, such as repairing of wheelchairs and equipment that they might use in order to move. But I would like to change a little bit the subject, and not to talk about what we're doing in São Paulo, but to propose a new perspective on what's happening now, and especially what's happening with people with disabilities all over the world. These days, and it's true, people with disabilities are under a lot of pressure and under many different threats. Not only the threat of not receiving, assistance, medical assistance when they need, but also we have the perspective of threats on rights conquered, very, very hardly along the last decades. We know that in such crises, I mean, when you know governments have to cut budgets, you know, the people that need the most suffer the most as well. So we are under many different threats that we have to you know, prepare ourselves to deal with them, and as well as we have to be united in order to have political power to resist and not to let you know, our rights, you know, any threats on our rights. But you know, my proposition is different, is in a different direction. In the midst of all this negativity or all these threats towards persons with disabilities, I see a great window of opportunities that the digital transformation and the fact that unfortunately, at least for, you know, for the next months and perhaps years, we will live in a sort of or isolation. I mean, we're not going to have the contacts, you know, the social contacts we had before. You know, it will be a different sort of socialization. And I see you know, a great opportunity for persons with disabilities in this scenario. Now, as you know, working at home, you know, home office, telework is a great opportunity for persons with disabilities, because you know, the fact that you know, we will have more virtual will be you know, living in a more virtual society. Uh, I understand that this sort of equalizes, you know, makes everybody more equal. The fact that we don't have to socialize, you know, which is a pity. But on the other hand, it offers us a chance of, you know, being in the virtual world more equal, and to suffer less with the prejudice that, you know, it's still, you know, so strong with persons with disabilities. So as I see, there's a great window of opportunity in the virtual world. I think, you know, persons with disabilities will have the chance to be protagonists more than they are today in the virtual world. And you know, this serves for persons with disabilities that, you know, now work in real in companies in the real world.
You
But
need to
also
wrap
for
up.
I know I'm concluding. I'm concluding.
Good.
I'm concluding. You know, it's good for persons that are already active in society, but it's also, you know, a great window of opportunity for persons with disabilities, talented persons with disabilities that can't live home, you know. So so you know, well, that's what I want to be my contribution. Again, to conclude, in the midst of you know, threats and such negative you know, things that are happening these days, I see, you know, a positive way out. You know, a great window of opportunity for persons of disabilities in this virtual world, you know, together with the digital transformation that we're going through.
Thank you.
That's it. Thank you very much.
Thank you, Sid. Thank you for those inspiring words. I fully share with you this vision of hope. And I always say it is not naive to think that there is a window of opportunity here. I think you're absolutely right. I also want to take this opportunity to thank all of the cities, including Sao Paulo, that are signatory of the Global Compact of Inclusive and Accessible Cities. And those very few cities that are today with us and have not signed up yet, we have high hopes that you will be signing up very, very soon. So thank you for those inputs. I guess you are calling also, Thid, to not the new normal, that we need to be aware of a very different type, transformed world where there are different opportunities for us all, and very high opportunities for a better quality of life. Let us see whether Dr. Busra Al-Mula, the Executive Director of the Department of Community Development of Abu Dhabi, shares this hope with us. The floor is yours, and thank you again, Thid, for your inputs.
Thank you, Emilia. Hello, everyone, and thanks for hosting us today, and thanks for this great webinar that talks about a vulnerable group that needs to be looked at, and we need to take actions to improve the quality of the service provision and the quality of their life. We all know that I'll be talking a bit of the global impact from the pandemic, and I'll talk about a few initiatives that the city of Abu Dhabi implemented in this pandemic in regards to people with disabilities and senior citizens, as well as on the United Arab Emirates level, what was done. So we all know, we all are aware that this pandemic have affected everyone, regardless of the vulnerability, and the vulnerability are the ones who were affected most. So no one was expecting that life will be changed, people will be working from home, there'll be online education, and there are a lot of people who cannot even access education. We are very lucky to have an access to education. In that regards, at the beginning, when the pandemic happened, at the beginning, maybe lots of education systems were not ready, especially those who are serving the PODs. So schoolings were stopped. In the UAE, the schools were ready and they had the online learning platform that I was already involved in that back from 2014. We were working on the smart learning back then, but we would never expected that we would use it in this time and we would be needing it. So immediately the schooling was smooth. The challenges that we had that were for centers, for people with disabilities, that this is a new norm for them to stay at home and they're not used to online education. And the sudden cut of the therapy and the rehabilitation services has affected, and we said that people's life will be impacted. We know that certain regression will happen, but not full regression, because we had complete work from home, and schoolings were stopped, but lockdown happened later on. By the time that lockdown happened, people adapted to that very fast, and we held a couple of meetings with the entities that are providing services, knowing that Department of Community Development in Abu Dhabi is a policy maker. So we look at the social area and the social sector in regards to policy setting, laws, regulating of the social sector, but not providing the services. Services are provided through different entities. We have around 11 social entities that they provide. So we had a meeting immediately to look into the plan. I would say seniors were affected a lot, especially those who are living alone. Here in the UAE, we have a lot of people who are living in the extended families, and we don't have seniors home here. People are either living in their own home alone or with their own family. So those who are alone got also affected by the pandemic. We know that the mental health issues have increased, especially for those who are vulnerable to getting mental health. So a few actions the government took in the UAE. First of all, we activated the online rehabilitation and the services for people with disabilities. Maybe I was one of the first one who has a personal story that I can share, rather other than the city level. I have a son and he has autism, and he goes to university. So the university started the teaching online, and my son has a full-time shadow. So I insisted from the shadow teachers and the therapists that they provide him online and to not come to the house, to keep the physical distancing. There was a bit reluctant. It took him only 2 weeks. I said, they'll have to learn. They have to go through that learning curve. And everyone went through that learning curve. And now they're all adapted to it, and they're learning online. So similar to that experience that I had, it's applicable to the centers here for PODs and schools. So it took them at the beginning. It was not easy for parents. Parents are working from home, and they are also caregivers and working now. So we had few policies. The government was the first to act and have a policy for mothers to be at home, mothers of children below age of 15. Seniors were not allowed to be at work, and those are the category, and also pregnant women. And those who have also chronic conditions, they were not allowed to work from the office, and then everyone worked. The implementation of full work from home was implemented later. So these are the few actions that took in place. People with disability had to work from home immediately. And the schooling, we started having the online services was activated. It took time for them to get used to it, but it happened. The government initiated a couple of other services for them. And I could see some of the governments have done the same. We have activated the toll-free hotline for counseling for parents of people with disabilities, and we were providing consultations as well as for senior citizens. And we activated some social sector services like providing food, healthcare.
Half a minute.
Sorry?
Half a minute. You need to start to wrap up.
Okay. So the government started providing, even the testing was for free, and they go to their housing for PODs and seniors, and the food for the seniors, they call them, they ensure that they have enough food, and they provide them with the food. There's lots of education awareness materials that are accessible have been provided. Medications are provided for free, and they deliver it to the house for people with disabilities and senior citizens. So many actions have been taken by the government to do so. That's on Abu Dhabi level. Also, the protection framework was in some way.
Thank you.
Thank you.
Thank you. Thank you. Thank you very much for those very important practices. I was checking the chat while you were participating, and I think it's important to share with the group. Belén Bath is warning us that working from home cannot become the only option. I would say for anybody, but in particular for people with disabilities. It has been a group that has been invisible for a very long time, and we want that group to be visible and to be part of society. So I think we need to find that balance. But thank you very much for those important measures that I think are very helpful in the midst of the pandemic. Thank you from Abu Dhabi. I would like to go now to a different reality, that of the Vice Mayor of Sousse, Imen Oudani. The floor is yours.
Merci à vous tous. Vous m'entendez, n'est-ce pas? Vous m'entendez? Très bien. D'accord. Comme je ne pouvais pas envoyer ma présentation, je ne sais pas si je peux la partager avec vous.
On va essayer, mais entre-temps, est-ce que vous pouvez déjà commencer votre présentation?
Oui, bien sûr. Alors, nous à Sousse, comme vous le savez, cette période de pandémie a dévoilé beaucoup de réalités, notamment au sujet de la migration et des migrants. Maintenant, on commence à entendre les gens parler des migrants, de leurs conditions de vie, de leur situation irrégulière, des lois qui sont sévères par rapport à la résidence de ces migrants. Et donc, cette période nous a montré comment le peuple a mis le point sur les affaires migratoires. Le coronavirus a affecté également positivement. Je ne veux pas parler de l'impact négatif, mais plutôt de l'impact positif. Comme il y a maintenant, on a établi une communication entre les migrants et les autorités locales et les organisations, les représentants des organisations de la société civile. À Sousse, on a commencé depuis quelque temps une grande action qui est une première dans toute la Tunisie. C'est on s'est rendu compte qu'il y a de l'absence d'une base de données sur les migrants, que ce soit au niveau national que régional et local. Et donc, on a mené une action sous un slogan qui est Solidarité sans frontières, solidaire. Et donc, on a commencé tout d'abord par la constitution d'un comité de gestion des aides sociales. Ce comité, il est composé du commissariat régional des affaires sociales, de l'Union tunisienne de la solidarité sociale, des organisations de la société civile, de syndicats, etc. Et bien sûr, on a essayé aussi de renforcer la coopération et le dialogue multiniveau, que ce soit avec les autorités nationales qu'avec les services déconcentrés. Et donc, à travers ce réseau-là, à travers ce dialogue et cette coopération, on a pu avoir de données sur le grand Sousse, bien sûr, parce que là, on a travaillé sur leur grand Sousse et non pas sur le périmètre communal. Et là, actuellement, on dispose d'une base de données sur les migrants résidant à Sousse. Par la suite, on a voulu unifier les efforts de ces organisations. Comme vous le savez, les associations ont vraiment fait preuve de solidarité, que ce soit envers les Tunisiens démunis que les étrangers aussi. Et donc, on a voulu unifier ces efforts et on a commencé à à lancer un appel aux dons, une action bien sûr sous l'égide de la municipalité de Sousse, et on a sensibilisé le grand public, que ce soit les autorités centrales, que ce soit les secteurs privés et les associations et même le simple citoyen. Par la suite, à travers cette action, donc, on a pu avoir de l'aide, c'est-à-dire en nature ou bien en espèces, mais il s'ajoute un autre aspect. Donc, tout d'abord, on a fait comme toutes les villes, c'est l'aide sociale par des dons en nature ou bien de la nourriture, etc. Par la suite, on a voulu toucher plusieurs aspects qui concernent les migrants. Et donc, on s'est dit qu'il ne faut pas se limiter à la nourriture. Et donc, maintenant, on est en train d'offrir de l'assistance médicale, psychologique, de l'assistance hygiénique. Et aussi, le plus important, c'est le culturel, l'aspect culturel. Là, je vous informe que il y a 2 jours, on a pu assurer la circoncision des enfants de la communauté musulmane africaine subsaharienne avec leurs confrères tunisiens. Et donc, cette action a renforcé la relation avec et l'inclusion de ces migrants à Sousse. Une dernière, comme je n'ai pas beaucoup de temps, j'essaye d'être un peu rapide puisqu'il y a beaucoup de points. On a beaucoup travaillé sur l'aspect médical, santé, même la désinfection des locaux des foyers universitaires, que ce sont des migrants aussi. Et donc, maintenant, comme je dis, tout le monde qui est concerné par l'affaire migratoire, maintenant, il est bien conscient de l'importance de ces migrants, l'importance de les réintégrer après le coronavirus. Et donc, on a commencé déjà à penser à des stratégies de réintégration économique de ces migrants, comment améliorer l'accès aux services publics, aussi accès à l'information, et le plus important, c'est la numérisation qui va nous faciliter tout ça. Merci.
Merci, merci bien, Madame la Vice-Maire. Very important points that are being made here, and thank you for bringing the perspective of the migrants, because there are many vulnerable groups that we need to secure accessibility to local service provision. And if we take care of those groups, we will be ensuring better livelihoods for everybody else in society. So a very important approach from migrants, and we do hope that you will be signing up the Global Compact for Inclusive and Accessible Cities very soon. Certainly the work that you are doing fully deserves it. So thank you very much for this intervention. And allow me now to go to another continent, a different reality, a world city that has been very badly hit by the pandemic, as many others around the globe. I would like to invite Victor Calise, the Commissioner of the Mayor's Office of People with Disabilities of New York City. Floor is yours.
Thank you. It's a pleasure to be here today, and I want to recognize Amelia, Maimuna, and Maria Soledad for your comments earlier today, really talking about cities, how unprepared they are, and the inequities that exist, and how we must push this forward in today's COVID pandemic and really capitalize on some opportunities here today. So thank you. And of course, thank you to the mighty Victor for continuing to get the world together on these important issues. And New York City has been one of the original signatories, as well as Sao Paulo, to the Global Compact. So we want people to continue to sign on. As you mentioned, I will try to be as brief as possible and give you things in a New York minute, because I know we're running out of time. We are the epicenter in America. We have over 15,000 deaths that are happening. We are a city of 8 million, with close to 1 million of those people with disabilities. And we are having issues. We're having issues on food supplies. We have set up 400 sites for people to pick up food, but some people with disabilities are not able to get there, or they have compromised immune systems. So we set up lots of resources to deliver food to people with disabilities throughout the city. You could find out this information by going to nyc.gov/getfood. People can call or text 311. They can check out our website. So there's lots of ways for us to be able to get food to people with disabilities that need it. We do see some problems here and there, but when we hear about them, we correct them rather quickly. Another issue that we have, healthcare workers, personal care attendants that work with people with disabilities to ensure that they have independent life. And there are city's direct workers in long-term care settings and are crucial, and are essential workers who are caring for the most vulnerable. And we have to make sure that these workers have what they need, because if they don't, people with disabilities will flood the hospitals, and we don't want that. So we have worked with our service providers and independent living centers within New York City and healthcare providers to deliver protective equipment, making sure they have masks, gloves, face shields. And we continue to do that because we want to ensure that people with disabilities can live the most independent life and not get sick and flood those hospitals. We are conducting outreach because we know it's important to reach out to the disabled community. We'd like to think we know it all, but we don't. So we have a check-in with disability advocates and partners every week, and which is a 1 p.m. call on Fridays. So if you happen to be in New York, please let us know. We'd love to have you on the call. And we make sure it's accessible with captioning in American Sign Language, so we can provide the community with the latest updates on COVID-19 and what New York City is doing. And we have people from all over different city agencies to ensure that we continue to get the latest information. We have disability service facilitators in agencies across the city, which are contacts that work in each agency and we provide them with the news updates and what they're hearing in the community, so we can coordinate efforts within city government to make sure that happens. We have also, as a result of the conversations we've had, we've launched a disability-specific website for COVID-19 for resources available, and you could find that at nyc.gov/disability-coronavirus. And there are resources on food delivery, updates on city's resources, and multiple lines of contacts to our office for people that need assistance. And we know that people are worried about facing discrimination and harassment during this pandemic. Access to care, will care be rationed? We don't want those things to happen. We want healthcare providers to really think that they're looking at the person and not the disability. So if people do feel discriminated against, they can certainly reach out to our Commission on Human Rights. We're working across our state human rights to make sure that people with disabilities are represented in this pandemic and can get the care that they deserve. And for people that aren't able to leave their home, we certainly want them to have the support. And the last thing I'll leave is home activities. We want to make sure that people have home activities, have access to virtual events, museums, tours, workouts, performances, and podcasts. And one last thing is our Department of Education has remote learning, and we make sure that everything is accessible on accessible digital formats, but also for kids and families that don't have the resource, such as iPads and internet connection. The City of New York is providing that so they can get the proper education that they need to be able to do. And when we have an accessible virtual meetings, we make sure that they're accessible, and we put out digital guidelines for that, which I will send out in a chat right now. I want to thank everybody for your time, and I hope that was a good New York City minute.
Yeah, no, absolutely. Thank you very much, Commissioner. I really appreciate that you have been very honest about not being able to do everything well, but at least monitoring everything that you know that needs to happen and trying to get it right. I think that's the main message. And one very important message as well is these checkpoints with those that know what they need. Checking with the communities, checking with the disabled, I think is a very critical thing. If you look at our survey earlier in the session about how many feel that they don't know enough to act, I think that's really, really critical. So thank you for these inputs, and we will certainly continue encouraging the compact together with you. Thank you. So let us now go to we are remaining in the Americas, and we are going to Montevideo. And I would like to invite Fabiana Larissa, Director of Social Development of Montevideo. Fabiana, a ti la palabra. ¿Estás lista?
Lista. Muy buenos días para todas y para todos. Es un gusto, y la verdad es que más que bienvenida esta oportunidad para intercambiar, y estamos aprendiendo muchísimo de escuchar las experiencias de otras ciudades, de otros gobiernos y también de algunas organizaciones que tienen muchísimo para aportar. Lo primero que les quería compartir es que en Montevideo ya hace un considerable tiempo que todo lo relativo a personas en situación de discapacidad procuramos trabajarlo en el marco de la Convención Americana de los Derechos de las Personas con Discapacidad, y por lo tanto nosotros trabajamos todo lo relativo a accesibilidad con perspectiva de derechos. Eso para nosotros fue un paso muy importante, ya que pasamos de abordar la situación de discapacidad de las personas para trabajar la perspectiva de la accesibilidad, considerando que la discapacidad es ante todo una problemática que es responsabilidad de los gobiernos locales y de las ciudades, en cuanto a que nosotros tenemos que eliminar las barreras que limitan esta libertad que emergió de forma tan contundente en el día de hoy, que se ve condicionada por la situación de discapacidad. Es decir, que no es responsabilidad de la persona que está en situación de discapacidad derribar esas barreras, sino que esas barreras están en el medio, y a las ciudades nos corresponde modificar ese medio, modificar esas barreras para que todas las personas tengamos el acceso a todos los derechos. De esa forma, y entrando ya en nuestra respuesta a la emergencia relativa al COVID, contarles que nosotros abordamos sobre todo 3 situaciones críticas en las que nos sumergió esta pandemia global. Primero, lo relativo al acceso a la salud, en segundo lugar, a la seguridad alimentaria y en tercer lugar, a la vivienda o al techo. En cuanto a la salud, Montevideo tiene una red de primer nivel de atención en salud y trabaja coordinadamente con todos los niveles de atención en salud que corresponden al gobierno nacional, es decir, al otro nivel de gobierno. Cuando se decretó la emergencia sanitaria, el primer nivel de atención en salud se vio comprometido porque las redes de salud a nivel nacional suspendieron la atención en primer nivel para depositar toda su energía en la atención sanatorial y hospitalaria, dada la posible emergencia sanitaria instalada en los hospitales. Eso, a nuestro punto de vista, estaba limitando el acceso a la salud, incluso teniendo en cuenta las consideraciones de la emergencia sanitaria, por lo que fue una decisión del gobierno local mantener abiertas y con atención al público la red de primer nivel de atención en salud en las 24 policlínicas que tenemos en el territorio, y esta fue una forma de garantizar la accesibilidad a la salud para todas las personas que habitan en Montevideo, ya que de otra manera quienes están en las partes más alejadas de la ciudad y de la localidad iban a tener mucho mayores dificultades en acceder a la atención en salud. Eso además fue refrendado luego por la ciudadanía, que terminó demandando y se terminó concretando que el primer nivel de atención en salud, que dependía del gobierno nacional, en última instancia también se terminara abriendo al público y brindando la atención. Lo cual hasta ahora, con algunas condicionantes, por supuesto, en relación a cómo debe trabajar el personal, ha sido posible sin disminuir las posibilidades de atención en los centros hospitalarios, que por supuesto es lo de mayor gravedad. En cuanto a la seguridad alimentaria, sabemos, y en Montevideo no es ajeno, que la emergencia sanitaria derivó también en una emergencia social y en una emergencia económica, que en Montevideo se ha profundizado significativamente debido a que muchas personas quedaron sin trabajo o están en seguro de desempleo, y por lo tanto, una de las primeras respuestas sociales de esta administración fue brindar canastas de alimentos, es decir, paquetes de alimentos que tuvieran toda la gama de alimentos necesarios para tener una alimentación saludable y para tener todos los complementos nutricionales necesarios, que se brindaron a todas las personas que quedaron desprotegidas y que quedaron sin ningún tipo de ingreso. La forma de brindarlo, además, fue de manera variada. En algunos casos...
Un minuto, Fabiana.
Sí, en algunos casos se permitía el retiro de alimentos en el local, y en otros casos se brindó, se llevó hasta el lugar para evitar las barreras de locomoción que pudiese haber. 2 cosas que quería compartirles en particular en relación a las personas en situación de discapacidad fue que con nuestro Centro de Referencia en Tecnologías para la Inclusión, que pertenece a la Intendencia y que tiene especialización en utilizar tecnologías de la información para personas en situación de discapacidad, se armó todo un paquete de recursos y aplicaciones para compartir actividades recreativas, educativas y también de asesoramiento a las personas en situación de discapacidad. Y también habilitamos una línea telefónica de atención permanente para que las personas en situación de discapacidad pudiesen recibir cualquier tipo de asesoramiento que necesitaran, de manera que la administración se acercara a las personas y no esperáramos que las personas tuvieran que acercarse a la administración en estos momentos. Y sí nos pareció también una oportunidad de llevar a que esto que nos llevó a todas las personas a estar en casa y nos mostró las limitaciones de necesitar estar en nuestra casa, a la reflexión de cómo las ciudades tenemos que seguir acercándonos a todas las personas y no esperar que las personas lleguen a nosotros, y nuevamente abordar las problemáticas de discapacidad y accesibilidad como barreras que están instaladas en las ciudades y que es nuestra responsabilidad derribar, y no volcar en las propias personas en situación de discapacidad la responsabilidad de acercarse a ellas a nosotros, porque eso sería limitar sus derechos humanos y sobre todo limitar esta libertad que tanto emergió en el día de hoy como una consecuencia de una real accesibilidad.
Muchas gracias, Fabiana. Nos quedamos con eso. Es la responsabilidad de toda la sociedad, hacer que sea una sociedad adecuada para todos. Yo diría no solo de los gobiernos, también de las comunidades. Aquí hay responsabilidades compartidas y me encanta que hayas traído a colación la importancia de no solamente proveer comida, no solamente proveer trabajo, sino la accesibilidad es también para más cosas. Sobrevivir no es suficiente, digo yo siempre. Hay que tener también acceso a cultura, a creatividad, y entertainment for everybody is also very, very critical. I'm very happy that both you and New York City have brought that up. It's not only about the basic needs, but all the needs. Let us take this opportunity. Thank you, Fabiana, for bringing the experiences of Montevideo. The last speaker of this panel, Johanna Sepala, the head of participation and information unit in the City Executive Office of Helsinki. Welcome. The floor is yours.
Thank you. Here is Johanna from Helsinki. I just got this invitation today, so I apologize that I don't have so much to share. But first of all, I would like to share what is the situation here in Helsinki. The mayor has his meetings about COVID situation every day with other leaders of the city. And the mayor has been underlying very strictly that we should make very good cooperation with national level, because in some cases the national level is making some rules or new laws without hearing the city levels, and it has been very crucial to us to make sure that we are following up to that regulations and the new laws, but to inform national level that what things are very critical to the cities. And the COVID situation has been hitting the Helsinki rather hardly in Finland, because most of the cases, I don't remember, was it 30 or 40% of the cases has been found here in Helsinki. So somehow we are hitting the pandemic very strongly. But some practical examples about what we have been doing here in our city, because digitalization is in rather high level in Helsinki, and it's very hard that some places like residential houses, libraries, and so on that has been closed, and people don't have smartphones or laptops at home, and they are not able, for example, apply support for financial support or apply income support. And then we had to open a new place where, sorry, did I drop out?
No, Josh.
You are still here. We can hear you. Please go ahead.
Everything.
Okay.
Yeah.
Sorry. So we opened a temporary digital service point to serve the city's residents who don't have their own computers or smartphones, and it has been very helpful for poor and also elderly people. And in April, we also opened so-called Helsinki 8, and we opened it together with the Paris. The first steps we made was that we called everyone who is over 80 years old in Helsinki, and the second step was to call people who is over 70. And why we called them to just check how they are doing. Do they need any assistance, for example, for shopping or for pharmacy? And for that, we moved several of people who are working for the city to work for the Helsinki 8, and it has been a very successful story because our employees has been very, very happy to do something different in this situation. They really feel that they are doing something unique to help and build that society. But that was my remarks, and please ask if you want to hear something else. Thank you.
Thank you very much. Thank you for this humbled approach. While I actually think that that Helsinki is doing many things. So thank you for sharing your experiences, and we look forward to continue collaborating in the future. I'm not going to go through all the ideas that have been shared in this panel, because we will have the opportunity to do a wrap up later on, and we will try to make the connections. But I think, Victor, a lot of the things that have been covered here are very helpful for your panel now, starting now, because everybody, and this is what I love working for local and regional governments, is that they are not only thinking about the crisis they are facing, we are facing, but they are already thinking about the next steps, the aftermath. And I think that is extremely relevant. So, Victor, if we're in your hands now, good luck, my friend.
Thank you so much, Amelia. It's truly an honor to bring 8 weeks of gatherings with you and share the findings we've actually, as you know, when we launched the Global Compact on inclusive and accessible cities in Berlin, we couldn't have imagined that New York, as a founding signatory, would be at the front line of this crisis and would be sharing experiences with Sao Paulo and Abu Dhabi, and then that we would join with other signatories like Helsinki and with Barcelona to really understand how cities can learn from each other. But this isn't just about what the cities can learn from each other. It's about a multi-stakeholder platform that has academia, that has the development agencies like the World Bank, that has other stakeholders, whether it's regional and national or grassroots organizations that work on massive initiatives like Special Olympics, or very local initiatives like the San Francisco's Disability Justice Coalition to provide food and shelter, and to find linkages between homelessness and between mental health and between economic isolation and economic empowerment. So with that, let me jump straight into a really dynamic group of partners and really hear from them what they've been doing. Maybe start off with my dear friend, Charlotte McLean-Dalpo, who's been leading things at the World Bank, specifically within their group on urban resilience. Charlotte, would you like to say a few words?
Yes, of course.
Yeah, please, the floor is yours. And some of our partnerships with the World Bank, also how we're applying this, addressing the COVID.
Great. So thank you so much, Victor. And thank you to the United Cities and local government for the opportunity to share some of the work that we're engaged in the bank. As Victor says, I am the Global Disability Advisor to the World Bank Group, and I sit in the global unit and provide technical support across the bank on disability inclusion. So I think I want to start off with a very categorical statement, and that is that the bank is committed to striving for all aspects of disability inclusion in our projects. And so to make sure that this goal happens, what we've done is to put in place a disability inclusion and accountability framework that sets out a roadmap for World Bank staff on how to be more inclusive. And it identifies some key entry points. And central to these entry points is the principle around accessibility. So the entire document is built off of the principle of accessibility. The document also brings in a number of principles from the CRPD. Almost 18 months ago, the bank put in place what are a set of 10 standards, and these collectively make up the environmental social framework, which is referred to as the ESF. And the ESF is important for this discussion because it speaks directly to the issue around non-discrimination, and very importantly, introduces the concept of universal access. Now, what's important about these standards is that they offer the borrower. And this is obviously very related to the work of local government. And so I just wanted to flag those as an important piece of work that we're doing. To support the environmental social framework, we have developed a good practice note on disability and non-discrimination. And it too has a very strong dimension on accessibility. And then finally, in relation to our authorizing environment, we have 10 commitments to advance disability inclusion within the bank. These commitments were developed by our senior bank management ahead of the Global Disability Summit that was held 2 years ago in London and was co-hosted by UK Aid, the International Disability Alliance, and the government of Kenya. Out of these 10 commitments, there are 2 commitments that are directly linked to the discussion today. The one is to ensure that all public facilities in post-disaster reconstruction are disability inclusive. And then of course, the other one is around a commitment for better disability disaggregated data. And I'll come back to the data piece in a bit in relation to COVID-19. But just to quickly say, in order to monitor these commitments, we're undertaking a portfolio review of our urban projects, and we're benchmarking disability inclusive indicators for our projects. And this is with a view to develop a baseline. So what's central to the work of the bank, central to the work that we do at the bank, is to provide the technical and intellectual leadership on disability inclusion. And so what we do, a large part of what I do and my team does, is to build the analytics and the evidence around disability inclusion. And to this end, we've developed some very relevant technical guidance for bank staff. One of them is a very popular guidance book on disability inclusion in water operations. And that obviously is very relevant today when you think about the importance of hand washing and good hygiene. Similarly, we have developed a guidebook on disability measurement that sets out how to better collect comparable data, disability disaggregated, and introduces the use of the Washington Group short set of questions. So in many ways, this is a great segue to the importance of data and the importance of the lived experience of persons with disabilities in the time of COVID. And so we at the bank are delighted, absolutely delighted, to be partnering with World Enable and the UCLJ on the survey. And I would strongly encourage you to take the survey and share it widely amongst your networks, because we know that data is our solution to effective and inclusive policies and responses. More specifically on COVID-19 and persons with disabilities, at the bank, we've pushed out an issues paper on persons with disabilities that is being used for internal purposes. We've also provided technical expertise to teams in the bank on how to include persons with disabilities in various responses. And I have presented to senior bank officials on alternative formats for consultations of persons with disabilities and DPOs in forthcoming projects given the COVID-19 situation. I wanted to stress the point that we continue to host a series of check-ins with our colleagues at country level to make sure that we have the pulse of what's going on the ground. We're working very closely on the education piece. We currently know that 1.3 billion children are out of school, and that many of those will be children with disabilities. And so we are looking at supporting work around that. Again, through a survey which has gone out, we've had 3,000 responses to the survey that looks at the impact of COVID on children with disability. And then I just wanted to close by saying that this survey will become part of a larger discussion paper, which will be a global public good. So we will share that. and then flag the important point around sustained coordination. And this is great to be part of this discussion today, but I think sustained coordination means we go on after this. And therefore, I'm really excited to have been asked to join a UN time-bound task team under the leadership of the Undersecretary General Menendez. So that should be a very exciting initiative. And finally, I look forward to working with you all and learning about what works, but also learning about what doesn't work. And again, I invite you all to please take the survey, because data is going to be the solution for how we move forward. Thank you, Victor.
Thank you so much, Charlotte. As you can tell, we've built such a tremendous network of multiple stakeholders, from the World Bank to directly with cities to grassroots organizations. Get your leadership at the bank, get your technical capacity to leverage this data that we've built, that we will have together, will immediately open up funding in terms also in sub-sovereign loans, sub-sovereign grants as well. So that'll be important as we listen to cities, as we localize the Sustainable Development Goals. Let me also ensure that we have a continued engagement, as you said, with UCLG under the framework of this global compact. And we're really thinking of this as a 10-year campaign, with this year focusing on COVID, but in future years, looking at other ways that we can collaborate on data as well, and identify ways to open up access and inclusion in urban environments. Let me make sure that we have time for our other speakers. We have a really great intervention from Kristen Lang. Kristen Lang is a program specialist on disability inclusive humanitarian action at UNICEF. Kristen, we actually started World Enabled working with UNICEF in the context of drafting the UN Convention on the Rights of Persons with Disabilities. And we published a little book called It's About Ability. Now, so many years later, 13 years later, we're now working on this issue of disability inclusive humanitarian action. What has UNICEF done to merge its commitment on disability inclusive child development as well as humanitarian action? The floor is yours, Kristen.
Great. Thank you. Thank you very much for the opportunity to be here today and to learn from all of the speakers. It's been such a rich discussion, and so happy to have the opportunity. So while children haven't been so visible in the COVID-19 pandemic, they have been significantly impacted, and children with disabilities even more so. So at UNICEF, we've heard numerous reports of children with disabilities living in institutions, facing high levels of infection, serious complications, and even death. Children with disabilities also face increased risk of violence, exploitation, abuse, and neglect, as families and households are under increased pressure and isolated from their usual support networks. And in the context of school closures, children with disabilities who were already excluded from education are at risk of being even further left behind, as we often see that distance and remote learning programs are not accessible. So recognising this impact on children with disabilities, UNICEF has firstly produced 2 guidance notes on inclusion of children with disabilities in the COVID response. One of these guidance notes addresses access to water, sanitation and hygiene, to education, to mental health and psychosocial support, child protection and other services. The other note focuses more on persons with disabilities as actors in the response. And so it provides guidance on how to engage children and adults with disabilities as actors in response to COVID. Now with UNICEF, as was already mentioned in the introduction, I work on disability inclusive humanitarian action. And in humanitarian action, we know that emergencies present us with opportunities. As we've already heard from many of the speakers today, this crisis has forced us to rethink the way we deliver services, the way we do our work, interact with each other, and the way we protect the most vulnerable in our communities. And we're now finding that some of the changes that we've made are for the better. So at UNICEF, we're working to make sure that everything we do in response to COVID contributes to building a more inclusive society. And I'll just touch on 3 examples as briefly as possible. So firstly, the pandemic has highlighted that more than ever before, that children with disabilities face risks living in institutions. Not only high risks of infection, but also of abuse and neglect. And in a new normal, UNICEF is working on ensuring that we make a renewed commitment to ensuring that every child realises their right to grow up in a family environment and that families are properly supported in this. So in Kyrgyzstan, for example, UNICEF is working to strengthen community-based services for children with disabilities, is providing support to parents and working to address a lot of that stigma that often leads to placement of children with disabilities in institutions. Secondly, even before this crisis, children with disabilities were more than 10 times more likely to be out of school. And now we're being forced to think creatively about how to ensure that children can continue learning despite extensive school closures. So in the new normal, UNICEF is working to ensure that this creative thinking and this investment in adapted approaches to learning extend to all aspects of education. And as schools reopen, we're working to support education actors to adapt curriculums, teaching and learning materials to ensure that they're more inclusive of all children. So for example, in Uzbekistan, we've supported tools for children with disabilities and from ethnic minorities that feature sign language and multiple language subtitles. We also provide print and digital resources for parents and caregivers to help them support their children during the crisis through daily activities and tips. As UNICEF has seen, and as many families can confirm, being out of school has a huge impact on children that goes well beyond academic outcomes. Thirdly and lastly, throughout this crisis, we've also been reminded of how important access to information is. And children, thankfully, have not been forgotten. We've seen numerous examples of information being presented in child-friendly formats, and even, for example, leaders hosting press conferences for children. In UNICEF country offices, we've also seen many great examples of information being made accessible to children with disabilities through the development of accessible and child-friendly formats. So for example, in India, UNICEF produced information about COVID through videos with puppets and sign language. And this was done using local resources without even access to a basic studio setup. I personally haven't seen this level of commitment to accessible information in any other emergency that I've been involved in. And I'm hopeful that this will become the new standard and this will become the new normal. We've seen clearly throughout this crisis that it is possible, even in more challenging and resource-constrained settings, to ensure that information is always provided in accessible and child-friendly formats. So we're hopeful that this will become the standard way of doing business. Now, I've aimed to be very brief, so these are just some examples. There are many more. As UNICEF, we look forward to continuing to work with all of you to ensure that children with disabilities are no longer left behind. We need to ensure that everything we do as part of the response to the crisis contributes towards this goal, and that we realise every opportunity to build more inclusive communities and service systems. Thank you very much again for the opportunity.
Thank you so much, Krista. The work that UNICEF's doing directly with cities and in cities is also important. And we worked together at the World Urban Forum with your colleague that was developing the Child-Friendly Cities framework. And it's really important here to think about the multi-generational solidarity that develops through inclusion and accessibility. Specifically, as we think about accessible cities, allowing all of us to be able to contribute our talents and benefit from what the city has to offer. We had two other participants that have given me the word to share with you, and because we're a little bit short on time, I'll share two of the perspectives from who are the partners. One of the very important partners, a dear friend of Amelia and I, within the GAP, which is the General Assembly of Partners, and that is Professor Jeannie Birch at the University of Pennsylvania, who serves as the president of the GAP. And she really wants to stress the importance of multi-stakeholder partnerships around inclusion and accessibility. So as we think about the multidimensional nature of the pandemic, understand that there's multiple lifestyles, preferences, and contexts within which different communities are experiencing the pandemic. And the only way to create an inclusive pandemic response is to look at the intersections of all of these major stakeholder groups, whether it's women with disabilities, children with disabilities, older persons and their impact, as well as other groups. How are parliamentarians? How is the private sector thinking about ways of incorporating and eliminating barriers? And ultimately thinking about multi-stakeholder partnerships, like we're building with UCLG and UN Habitat, and especially with the Office of the UN Special Envoy on Disability, Maria Soledad Sistemas, is really helping us do that, a platform to exchange learning and build a community that is able to create those policies and programs. The other partner that we have is a private sector, and we've been working closely with several private sector leaders, including, for example, with Huawei, the telecommunications company, that will be sponsoring the development of a video and a social media campaign on Cities for All. So our story about empowering cities and our work with UN Habitat, with Maimuna, with Amelia will be featured in this short video that'll be launched in June to really elevate the visibility of our collective efforts. Well, those were the interventions for this part of the webinar on radical inclusion and building multi-stakeholder partnerships. But if you'll permit me, Amelia, we're now coming towards the end of our webinar, and I want to be able to share with our joint audience some of the things we have planned for the next year. Does that sound good, Amelia?
Yeah, absolutely, Victoria. We will do the wrap up in a moment. I think it would be good for you to start with with the roadmap. And I then would like to give the floor to the Secretary General of Metropolis, who is also very committed to this topic and hopefully will help us expand the approach among the biggest cities of the world. So the floor is yours, Victor.
Excellent, thank you so much. So I will share my screen now to provide a little bit more context as to how our efforts over the last few months have brought us to where we are today. And really the context that allows us to really leverage the unique capabilities and experiences. Again, a lot of this is really about building back better. And this joint effort to bring the webinar series on equity and access to the UCLG community, to the live learning series, in partnership with UN Habitat and Metropolis is very valuable. But the lessons that we're going to share today are out of 9 weeks of a network that we've developed with the UN Special Envoy on Disability under her leadership, as well as with support from the German development agencies and the GIZ and BMZ and different knowledge partners like the University of California, Berkeley, Columbia University, and other sponsors as well, Disability Inclusive Accessible Development Network. So as you can see, this is unprecedented in terms of how many new relationships are forming to really shape this great transformation. And I call it a great transformation because I myself, as an urban planner, as an urban scholar, and as a professor in the field of urban planning, see this ultimately as an urban transformation. I serve on the UN committee that helped draft the UN Convention on the Rights of People with Disabilities. And that document guides our knowledge and our understanding of how local efforts should incorporate these perspectives and ensure human rights. But COVID, with over 4 to 5 million confirmed cases and hundreds of thousands of deaths, has really impacted people with disabilities in countless ways. And we heard that from our distinguished panelists. But really thinking about how our network of signatory cities, which are nearing almost 20 signatory cities, of which Helsinki signed and Barcelona signed, and New York, Sao Paulo, Abu Dhabi, are looking at about their own strategies and looking about their own impact that they can have in their communities. And thinking how we can add value to those discussions. So the agenda for our network and our work together with you, Amelia, is to really ensure that we have continued advocacy and engagement and sharing the lived experience and the emerging issues within this continued dialogue. I think we really are thinking about network of networks and strengthening our coordination among different stakeholders, like with the World Bank, to overcome these data deserts and ultimately understand what we've heard over 9 weeks of discussions, understand what are the actionable responses. To address that, we have two new things that we'll be launching, and we'll be launching together with other partners over the next few weeks. One is, as you heard, this global survey on inclusive pandemic response that really targets cities and local governments. And we'll have the link here in the chat. And we'll also be sharing this through a press release tomorrow on the International Day of Accessibility Awareness. The Global Accessibility Awareness Day, as well as we're launching open documents to be co-created with cities on actionable recommendations for inclusive pandemic response. The open document will be available for input. So those are the ways that we want to address the data gap, the network of networks to address the knowledge gap, and create a knowledge map, mapping out all the resources and hosting that on a centralized knowledge platform, and then providing these declared actions. And I'll talk a little bit about that. Ultimately, the Equity and Access webinar series that we're now concluding is an important part of the multi-stage project of Cities for All. And that, again, launched with the Global Compact, this idea of stimulating and formulating and implementing evidence-based policies to mainstream disability and inclusive urban development. For this particular year, thematically focusing on the pandemic. So we completed phase 1, which is the webinars and agenda setting, and we're now going to phase 2 on policy formulation and data gathering. And that's going to lead us to phase 3 down below, where we'll be able to collaboratively develop a train-the-trainer model, as well as tools and other guidance that cities can take to really empower them to know what to do and to have confidence that their policies and programs are fostering more access and inclusion. And I think for that, it's really important that we realize that these declared actions is about coming together and about ensuring that local governments know what to do. And that's why I'm so proud of the leadership that Maria Sargazzi Sternas, the UN Special Envoy on disability and accessibility, has made, and the joint declaration, the note that we've published together and hosted with the UN to sort of ensure that there's a focus on local pandemic response. I think, some of the interesting things, I'm not going to go into the details, but the survey has already had over 250 respondents. And we're seeing a good representation of insights on different areas of non-discrimination and how cities are looking at or agree or disagree with various statements. Most people feel that people with disabilities are facing some discrimination in local COVID-19 pandemic responses. And that's why it's so exciting to hear New York set up very specific initiatives to ensure that you can report some of these challenges. But ultimately, as our opening speaker said, this is really a long-term transformation and being very frank about what we can do well and what we need to do better. And hearing that the efforts that we're undertaking, whether it's in Abu Dhabi under the Abu Dhabi Disability Strategy, under Bushra Al-Mullah, or in Sao Paulo under SID, or in New York under Commissioner Khaleesi, is really about sharing those experiences and ultimately knowing that those aren't going to be the ways that we can make more progress together. So I want to just bring this to the screen. The learning groups that we've created, you can take a photo of this and join.
To give you one more minute, Victor.
Sure. These are the learning groups that we have, Amelia, for city partners to join efforts and share experiences in WhatsApp to learn about how to make more progress. And we'll share this with all of our colleagues in terms of saying that even though we're closing the webinar series, inclusive pandemic response, the community and the dialogue is going to continue. I'm going to give the word now to the special envoy that'll just speak and give us some closing remarks. Pass it back to you. The floor is yours, Maria Soledad.
It's okay. Do you listen to me?
Yes, the floor is yours.
Yes. Yes. First, I think that in the spirit of the justice, for me, it's very important to recognize the great initiative of World Enable with the leadership of Victor Pineda. And I think that our experience in the web seminar, this web seminar and the series seminars are very, very important. On the other hand, the coordination of the Net Cities for All is very relevant because from this network, we can get genuine inputs to give to local governments and unit cities and local government organizations, because come from the civil society of persons with disabilities directly. And this is the spirit of CRPD, the Convention on the Rights of Persons with Disabilities. I think that this is a great value for this work. And finally, I think that is very important to count with all persons, the partners now, and other friends in the progress for Cities for All, because I think that is the real advantage, real progress now and forever for the future in 21st century. And thank you very much. And the joint statement you will find in the website of United Nations. Thank you very much.
Thank you very much, Special Envoy, for those words and our commitment to continue that that partnership and to also make the joint statement broadly known. Octavi de la Varga, Secretary General of Metropolis, some wrap-up remarks from the other big partner of this series.
Okay, thank you, Emilia, and good afternoon to everybody from Barcelona. I'll try to be very brief because I know it's been a long session, very, very interesting. And I think throughout all the learning, live learning experiences that we have had so far, Emilia, so that all the sessions at the end of the day were about rights. But I think especially today, we're really talking about rights and rights, equity, and freedom more than in the previous one. And it's clear what's coming from all the participants that, of course, if we want equity, we need access. Equity without access is not equity. They go hand by hand. And that's been highlighted pretty clear in different way by all the speakers. I think this pandemic, and from what I've heard, has confronted us to, I think there's a paradox, apparently, because on the one hand, in certain cities, all these people, all the people with disabilities and older people, and somehow they have gone invisible because of the lockdown. But at the same time, many people are discovering that their neighbors had some kinds of disabilities, and they're discovering that they have old people living next door that they didn't aware of. So maybe here this is also an opportunity to discover who we have around, and also to discover, we're discovering as well. Well, I think all the people here, we knew it, but the wider spectrum of people, they're discovering that, well, people with disabilities is not a homogeneous group. It's a heterogeneous group. And sometimes we forget about that when we're making policies and delivering services. And that's I think one of the issues we have discovered with the pandemic is that our services were not ready. They were not up. We thought even in the most inclusive cities, we thought we were ready to include all people. And we have realized that no, because when we're talking, and there were many examples, no, when talking issues about accessing to food, accessing to drugs, accessing to public services, mobility. I mean, those who had been in more disadvantaged situation has been people with disabilities and older people. And we need, and maybe that's an opportunity to rethink the way we are making policies and the way we are delivering public services to all citizens to ensure that no one is left behind. I think as well that it's an opportunity as well. Some people said as well that for a transformation in the way we have planned our cities and in the way we want to plan our cities. There are issues related to access, as I said before, access to public services, but there are issues about public space, how we are going to develop, how do we want to develop public space, which is accessible to everybody. Mobility, we are already talking a lot about changes in mobility and what are going to be the needs then in these new mobility patterns, and are we going to develop, take into account the needs of all people with disabilities in our cities? And I think this is something that I don't think many people are already thinking about it in a way, with a wider perspective. And as well, other issues like housing. I mean, we have discovered as well that maybe not everybody has adequate housing, and especially people with disabilities, they are not adapted. And then when they have to spend a lot of time inside the house, that this is a problem. So I think that's it. So I'm going back to this paradox. On the one hand, in certain areas, people with disabilities maybe have become more invisible because of the lockdown, but at the same time, at least it's showing all the contradictions of the system that we had before, and it's showing us maybe some of the changes that we need to introduce in the way, as I said, we plan the city, we build public policies, and in the way that we deliver public services. Thank you, Emilia, and thank you to all.
Thank you very much, Octavi. Well, thank you, Victor. You continue to be our guru, and you have pulled together a very impressive set of partners. My trust is that with that set of partners, we will be able to really make a big difference in how local and regional governments around the world are understanding accessibility, which is a lot about what Octavi was sharing with us. It's a lot about rights, but it's also a lot about service provision. And I just want to to quote some of the reflections that have been going on in the chat. A lot of the dramatic experiences that Silvia Corriat has been sharing from Buenos Aires about access to water and the impact for the disabled are related to the fact that we underestimate what some of the service provision outside of health are doing for our health services. And we need to change the conversation on that. And I fully agree with Shuti Xiao, who says that we need to keep learning and we need to keep sharing. And on that note, I would say, see you all soon, see you next time, but let us keep working together. Please do share those WhatsApp for Latin America that people are requesting. Let us keep at it. Please be healthy, keep healthy, keep calm, and keep creative. Victor, take care.
Thank you.
Everybody, thank you.
The team was amazing from UCLG and the team from World Enable that bring us all together.
Thank you. This is Walter from Uganda. I'm very grateful for this important meeting.
Thank you very